The current provincial state of emergency is definitely hard on everyone, but it is really hard on young people, on our youth. To talk about that from Pathstone Mental Health, we have the clinical manager, Erin Clayton, joining us. Welcome to the program today, Erin.
Thank you. Thank you for having me.
Some big challenges for young people facing not being able to see their friends, not going to school, having to learn online. How are they dealing with it in your eyes?
I think you've captured it well. I think a lot of our children and youth are really struggling with the absence of social connections. They're spending a lot of time on screens, and more we're seeing children and youth not being able to find hope, not really knowing what tomorrow might bring, feeling really isolated and alone, and just feeling like a lot of things are happening around them out of their control.
Some of these students visit Pathstone Mental Health during normal times and have a face-to-face conversation. They can't even have that avenue. So you're offering some online versions of these meetings with these children that need them.
We are offering still in person, so we are able to offer in-person sessions to those that need it. We have a virtual option for those some would prefer. They are wanting to not come in person for good reasons, good and valid reasons, worried about illness, the pandemic, or their loved ones around them who may be vulnerable. And we're offering phone sessions. We're trying our best to be as accommodating as we can be so that people are getting what they need from us as a service provider.
Are you still experiencing a high level of volume of calls and appointments?
This time of year, we usually see about a 25% increase in access to our services. And this year, we're trending probably to be more 45 to 55% increase just pre-Christmas and post-Christmas. So particularly January and February can be difficult months due to the seasons. The winter is long and cold and gloomy for people and under the best of circumstances. And we're really finding that the pandemic is exacerbating symptoms of isolation, just feeling hopeless, helpless, and at a loss. So we're seeing a lot of calls to our crisis services. We're seeing a lot of access to our walk-in crisis services. So quite unfortunately, at this time, we're only able to offer walk-in virtually, but people are really, I think, finding it as a really quick and helpful access point. And those that are in our longer term services are definitely expressing gratitude and being grateful to have somewhere to come and try to make sense of all that's happening in the world.
What are some of the things that parents should look for in their children to find out from them if they need to speak to someone at Pathstone?
Really looking at their daily patterns. Are they seeming restless? Loss of interest in things that they typically would like? Are they sleeping more, sleeping less? Are they really expressing a lack of enjoyment in things, seeming lethargic or tired or over-energized? It really can, these kinds of things can present for people in different ways, but parents should definitely be in tune to the daily routine of their children, how much time they're spending alone. Kids are spending a lot of time on screens just because that's where they're required to do school, but are they engaging with friends? And I think it's a lot of work for parents to be really attuned to their children right now. So if they notice anything that they feel like is a shift in any of those areas, they can give our crisis services a call, and it may be something that we can help them to problem solve through or get them connected so that they can come and speak to someone. The number is 1-800-263-4944, and that is 24/7 phone support. A live person will talk to you. They can walk you through any of the resources that we have on the website. They'll be able to speak specifically about your problem. I think the name sometimes is a bit of a misnomer for people. They think there has to be something of a crisis happening. That's not true. People can reach out to get information. People can reach out if they're just feeling confused or have a concern. You don't have to be in a crisis.